And then post-inflammatory hyperpigmentation, otherwise known as PIH, which is easier to say. PIH presents on a lot of people that have acne. So it could be caused from an irritation, or it can be caused from friction. It can be caused from trauma. And also, like I said, the biggest presentation I have of it on my clients is from acne. Or actually right now, we've got a lot of mosquitoes in Arizona. It's making me crazy. And so I'm seeing PIH from the mosquito bites. Sometimes I'll see PIH on my clients who have pellets that they've gotten for their hormone replacement therapy. So right where they place the pellets on their rear end, you'll see a little brown mark, which is actually the PIH from the pellet insertion. Usually when you're talking about how it presents, it's usually dark lesions, would be in the shape of what the acne was. So we look at that lower picture. The top picture is more from like bug bites and things like that. The lower picture is actually, fits close to fit 6, who has acne. And the acne goes away, but there's a brown spot that's left behind. And then that also people call scarring, which is not really a scar. It's post-inflammatory hyperpigmentation. Left alone, it would possibly go away, but we're talking about months to a couple of years before it goes away. So this is one of the biggest uses of chemical peels, is to help with PIH and help to get it off of the skin. Again, after I had PIH from acne lesions and cystic acne, I treated mine with both intense pulse light and also chemical peels. Now, when we look at the darker skin type, using intense pulse light isn't going to be an option for them, because their skin is going to become the target, which means you're going to probably blister them, and then you're going to leave another post-inflammatory hyperpigmented mark from the actual blister. So when we look at darker skin and how we can treat PIH, then we start getting down to probably a chemical peel is going to be the only safe way to treat them effectively. So where somebody like me could use intense pulse light because I'm a very light skin type, somebody who's fits 5 or fits 6 possibly can't use intense pulse light. So now we're down to what do we have to treat them, and chemical peels really fit into this role nicely. It also does help to manage some of the acne that's going on too. So let's talk about PIH a little bit more, because sometimes when you have a lighter skinned person, maybe it fits 1 or fits 2, when they have acne, when the acne is gone, the lesions left behind are red. And I know you've seen these in a lot of your clients. It's not technically PIH because it's not hyperpigmentation, but it is still considered a sign of inflammation. It's just more vascular. What it's indicating is the skin is still going through a healing process from the acne. It can take months and months to dissipate. Again, you're going to see it mostly in your fair-skinned clients. Sometimes it can appear as a bluish or purple, but again, it is vascular. How I treat this is usually with intense pulse light or a laser, a 532 KTP, which if you knew when I went through the laser section, you'll remember is what we use to treat vascular issues. So it's more vascular, and the little red marks are actually tiny broken capillaries, as opposed to hyperpigmentation. But you're getting it from the same reason. You're getting it from acne, and especially from somebody who picks acne. Now, when I had PIH, mine actually presented as brown spots. It was not red, but there was more of a cystic acne as opposed to, just papules or pustules. PIH and its brown discolorations is a true PIH. It's more common in darker skin. Again, I'm giving you guidelines. Obviously, my skin is very light, and I had PIH. And again, you can have somebody who's a Fitzpatrick 1, 2, or 3.5 pH, but you are normally going to see it in the darker skin tones. And this truly is a pH because it's post-inflammatory hyperpigmentation, which is browns. So when treating red discolorations, all right, so we're talking about the pH, call it pH, but it's really vascular. You want to use products that are going to reduce the inflammation and also help support the healing process of the skin. And one of the things that I try to work with my clients is letting them know that this is going to take time. It's not going to be a fix in a week. It's going to take some time before these red areas go away. So we want to reduce the inflammation on the skin. If we're using products that are treating brown discolorations, we want to help inhibit the melanogenesis, which is increasing the melanin production. So we would use products with kojic acid or licorice root or bearberry or things. Some people use hydroquinone, so things that are going to stop the melanin from producing. And then we're also going to exfoliate the melanin-filled surface scales, so looking at using chemical peels. But again, we want to look at reducing the inflammation and then not letting people produce more melanin. And one of the big things that you can talk to your clients about that is going to help with this is using a good sunblock. The sunblocks I use at our med spa are pure physical blocks. They are not chemical blocks. So they're things with zinc oxide or titanium oxide, things that are going to be a physical block between the person's skin and the UV light. So when people ask me if it's physical or chemical, how do you know? If you can't pronounce the ingredients, generally speaking, it's a chemical block. Like I said, I've switched over to pure physical blocks in my practice. You can do whatever you want in your practice, but take a look at the benefits of both of them and then make a decision. So treatment plan for hyperpigmentation. One of the big treatments is exfoliation. It's one of the reasons we do chemical peels. We also want to increase the cell turnover, so we're going to have some type of a retinoid product, whether it's a retinol, Retin-A. In our SSceutical product line, we have our Vitamin A, which is a 1% retinol product. The reason we went with retinol is one, you can sell it. It's not. It's basically over the counter. The reason in our SSceutical product line, our product Vitamin A is a 1% retinol because two reasons. One, it's over the counter. You don't need a script for it. But two, it tends to be better tolerated than a retinoic acid. Retinoic acid is going to work faster, but you will also lose some compliance in your clients because they don't like what their skin looks like while using it, which is completely normal. It's supposed to look that way. It's just uncomfortable. I know if I use even a low percentage, 0.25% Retin-A, within 3 days my skin feels chapped, it looks red, it looks irritated. It's supposed to look that way, but I don't like it, so I stopped using it. So ours is a 1% retinol. And again, you want to increase that skin cell turnover. So different things that are going to inhibit melanin from producing hydroquinone. So hydroquinone is going to suppress tyrosinase, and we're going to talk about tyrosine and tyrosinase and what actually they are. And it's going to help to get rid of the malfunctioning melanocyte cells. So hydroquinone can be in a over-the-counter level, which is less than 2%, or a script, which is 4% and above. And all of our products at SSceuticals, we've decided to go HQ hydroquinone free because hydroquinone has been known to be a carcinogen. It can be used for short periods of time. I would not recommend it for long periods of time, and you've got to watch the skin tone that it goes on because sometimes it can make the melanin produce more color, so that it actually gets darker. Other things that we use to inhibit the melanin production, again, retinoids, it also increases the skin cell turnover. So it can help to suppress the tyrosinase and inhibit its transfer into the keratinocyte cells. Vitamin C is one of the best ingredients you can have in products to help with both hyperpigmentation, and as an antioxidant for the skin, it helps with collagen production. So the vitamin C that we use in our products at SCCeuticals is an L-ascorbic acid. So it is going to help inhibit the melanin from even producing. And then licorice root also is a tyrannostasis suppressant, and that is in one of our products, which is our brightening cream. So when we're talking about hyperpigmentation, we want to use products that are going to inhibit the melanin from producing, but then also increase the skin cell turnover. So our turnover going from our basal layer to our stratum corneum level or layer is going to be going a little bit faster and turning it over faster to get those skin cells with the hyperpigmentation off of the skin. So when we talk about acne, and again, a lot of times you will have people coming in for chemical peels that it's specifically they're looking at, they have acne, so they think this is the first thing that they want to do is get a chemical peel. When we look at the causes of acne, and a lot of it again is going to be hormone related, but we have inflammation into the skin. We also have an increased production in sebum, which is your oil production from your sebaceous gland. And when we look at increasing our sebum production, then we're going to have an increase of what is the P. acnes bacteria. Now, if we think about what the P. acnes bacteria eats, it is the sebum. So when you increase the amount of oil production, or when the body increases the amount of oil production from usually hormones, then we're going to talk about now you have an increased production in your hormone levels, which is the food, are going to create the sebum, which is the food that the P. acnes bacteria is going to be eating. In Arizona, we have a lovely little critter that runs around here called a scorpion. Not sure if you have those up in your area, but we do have them here. And what's interesting is when we spray for scorpions, we aren't so much spraying for the scorpions themselves because they have an exoskeleton. Unless they lick themselves, they're not going to get the poison in them. What we're spraying for is the crickets. Okay, so the crickets are the scorpion's food source. So if you get rid of the crickets, either through killing them so they don't have them to eat, or the scorpion eats a cricket that has gotten the poison on them, then the scorpion is going to die. So instead of to kill the scorpion population, we go after the crickets. One of the things that we look at with acne is if you can lower the amount of sebum production, the P. acnes bacteria doesn't have as much of a food source, therefore it's not going to proliferate and it's going to die off, and the acne is going to get better. So there's different things that we can do to help with the sebum production, but again, it's also going to deal with hormones, and we're going to visit that in just a minute. So what happens is the skin gets clogged up at the top of the pore, and some of that happens through progesterone, and then you create an area that doesn't have any oxygen. The acnes bacteria starts to grow and it creates inflammation, and then what we do is we come up with our nice little dirty fingers and we go to pick it, and it ruptures into the follicle next to it and creates a friend. So if you ever notice that when you have acne, if you pick the acne lesion, then sometimes it has a buddy right next to it. Well, it's because you're causing that damage yourself. So it's one of the reasons we like to tell our clients not to pick their face, even though as estheticians we know that we're probably doing it ourselves. So let's talk a little bit more about acne and what can cause it. So when we look at the statistics of acne, 85% of teenagers suffer from acne. Now, sometimes we have a very heavy acne on a teenager's face, where it's basically covering it Sometimes we're talking about just a few breakouts here and there. I was not one of those that suffered from acne when I was a teenager. I was very lucky. I did have acne after my 30s though, so I had what was called more of adult acne as opposed to acne when I was a teenager. I think anything you can do to help people with their acne and start from a younger age is going to be beneficial, because it truly is one of those skin disorders that can cause a lot of problems with a person's self-esteem. I know one of my best friends in high school, beautiful, beautiful girl, still a professional model, was modeling back then, had horrible acne, and it really, I mean, she basically wore her face down in front, or her hair down in front of her face to cover up her skin. And back then, some of the treatments that they did on people with acne, you look at them now and you're like, oh my God, that was absolutely brutal. So we've come out with different chemical peels that help with acne in different products, salicylic acid and benzoyl peroxide that can help with acne. So it's come a long way. Some doctors will put clients on different antibiotics to help with acne. Sometimes we'll talk about a little bit about Accutane, which is an isotretinoin, which is vitamin A, but you take it systemically to basically stop the oil glands, your sebaceous glands, from producing oil. That's how Accutane works. Accutane, by the way, has been off the market since 2009, but there are different versions of isotretinoins that are out in the market, which are Clarivis, Amnestine, and Sotret. Those are still isotretinoins, which is a systemic vitamin A product to clear up acne. Now, when you get to the point where you're using a product like that, the acne is incredibly severe, where you're talking about cystic acne that probably is going to end up scarring the person's face with either ice pick scars or rolling or boxcar scars, acne scars. So when somebody is put on a drug like that, there is a lot of testing that is done, from testing their kidneys and making sure they're on 2 forms of birth control if they're a female, because it does cause birth defects if she was to get pregnant. So there is some different medications out there that doctors can prescribe to help from the internal point of dealing with acne. What we're really doing is working on the outside of the skin. When we look at women, you've had about 44% of women suffer from cyclical breakouts. What that means is right before their period, they have hormonal breakouts, and it's usually right around the mouth. And I swear to you, it's like if you have one here, every single month you get the exact same one. So that is very, very common in working with women, is right around their period, they're going to break out. And then about 20% of all adults are going to suffer from acne. And again, it all goes back to hormones. And so with acne, you're going to have a lot of hormonal components. But what we found in the past few years is some diets can lead to having more acne. So I suggest that you talk with your clients, because what we've shown, and back when I was in aesthetic school, it was told to us that diet doesn't contribute to acne at all. And I read the latest version of the textbook that I used in aesthetic school, and it still was saying diet doesn't affect acne at all, and I think that's wrong. I think if you see people that are having a lot of dairy in their diet, sometimes gluten, the acne will usually present down along the jawline and right through the neck. If they reduce the amount of dairy products and go to other alternatives like almond milk and things like that as opposed to cow's milk, the acne may lessen. Some people that have a gluten sensitivity will find if they cut gluten out of their diet that the acne gets better. So you want to suggest some different dietary things that they can do, or have them talk to a medical director and talk about different dietary things that they can do to help with their acne. But again, the hormonal issues, sometimes it's just the way it is, and so you just try to manage them. So the role of hormones and acne. And hormone fluctuations can contribute to acne in all age groups. It can contribute as they're teenagers up through with women perimenopausal. And what we see is androgen hormones, which are the hormones that are male hormones, and testosterone can help stimulate an increase in sebum. So when we look at teenagers and you look at boys versus girls, usually boys can have more acne simply because they have more androgens that are producing, and that's going to create more sebum. Now, as a teenager, and none of them want to hear this, the more sebum that you produce, the better you're going to age, actually, because your skin has got a lot of oil, which helps protect the skin, but they also probably are going to have a lot more acne. So telling somebody that's 16 who has horrible acne that, hey, at the age of 50, you're going to look really good, isn't going to go over very well. It's truth, but at that point, they just want to do something with their acne. And acne to everybody is different. So you could have somebody who has 2 acne lesions and completely freak out because they have 2 pimples. Or you can have somebody who has 100 pimples. And when I have clients come in to me and they've got like 3 and they're flipping out over it, I want to make sure that they realize that, okay, yes, it is bad because it's on you. But in this grand scheme of things, dealing with your acne isn't that big of a deal, because I've got clients that have an entire face full of acne, chest and back, and that is actually a lot more damaging because I know that if we don't get it under control, the scarring that's going to happen from it is going to be extensive. But I don't like to downplay my client with the 2 pimples because I know it's important to them because it's on their face. And I also know when I get a pimple, I could be the person that's freaking out. So let's talk a little bit about how hormones are going to I won't say interrupt the skin, but how they are going to influence the skin and create possibly more acne.